Good morning, everyone. I know a few folks are still logging in, so let's get started. Thank you for taking the time to join us this morning. My name is Jack McDougall, and I'm the President and CEO of the Greater Washington Board of Trade. Well, we launched this briefing series last year in March 2020, just when the COVID virus started spreading. And since then, we've hosted more than 35 of these webinars for our members and partners across the region as a way to share expertise and gain some new insights into how do we manage through this pandemic. I'm really pleased that nearly all of our member organizations have participated in some form of these briefings. And I want to thank everyone who has joined as a speaker, sponsor, listener, or contributor. Not many of us expected things to drag on now for more than a year. And finally, there is some light at the end of the tunnel. Many employers are trying to figure out when and how to reopen workplaces and bring their remote workers back. And this can be really challenging. But we must also recognize that many businesses have remained open and many essential workers have continued on the front lines throughout this ordeal. Equally important, many businesses and workers, especially in hospitality, retail, travel, and others, have suffered greatly, and many of those businesses have closed. And that impacts all of us. Our excellent panel today will focus on reopening closed workspaces and bringing people back. Specifically, we'll look at vaccines and health, HR and legal best practices, and transportation trends. We'll have a number of other conversations in the weeks ahead on other issues affecting all of us as we get back to business. As we get started today, I'd like to welcome our presenter, Evelyn Lee, the Regional President of Truist Financial Corp. Evelyn, thank you very much for your support and participation. Evelyn will provide a regional economic overview to set the stage, and she will facilitate the conversation with our panelists. And I want to thank all of them for joining us today. We're very happy to have you here. Reggie Jones, the DC office managing partner at Fox Rothschild, Shyam, Kannan, Vice President of Planning at Washington Metropolitan Area Transit Authority, and Dr. Jesse Goodman, the Director at Georgetown University's Center on Medical Product Access, Safety, and Stewardship. As a reminder, if you have any questions, please use the Q&A feature. We'll address them when we get to the end. Now, Evelyn, I'll turn it over to you. Thank you.
Great, thank you so much, Jack. I'll just do a sound check and make sure that you can hear me.
Yes, I can hear you.
I'm going to go with yes. All right, great. Well, welcome everyone. I want to echo Jack's welcoming comments and introduce myself briefly. As he mentioned, I am Evelyn Lee, and I'm the regional president for Truist, which is the merger between BB&T and SunTrust. I'm really looking forward to being with you all today and hearing from our panelists. I first want to acknowledge the Board of Trade, though, for putting this group of folks together. As you all know, as leaders and as business people, information and access is really critical to our decision-making. And when I and my colleagues talk to clients and are out and about in the market, there are often still more questions than there are clear-cut answers. So we're really looking forward to hearing from experts, as Jack mentioned, in public transport, in law, in HR, and of course, in the medical field. So thank you to the Board of Trade for putting this together. I want to thank the panelists as well in advance, both for their time in preparing for this so that we could ensure that we're giving you all information that's relevant and timely and needed to make decisions, and also for their time today. I will say that as we prepared for this event, it really was not difficult to put together questions for this panel. There are certainly topics on all of our minds, and these are things that we're all kind of turning over in our heads and looking at from different angles. There are questions about safety, about productivity, and really about what we know for the remainder of 2021 and what it may hold for us. So while a lot of questions and a search for clarity really continue and are at a premium, because I'm an optimist, I do think, and Jack stole my thunder a little bit about there being a lot of signs of positivity, I do think it's helpful to put today in context and in the context of where we've been. So when I flash back a year ago, we really knew so little about this virus, how it spread, what its effects were. I mean, just recall how your heart would drop when you would learn that someone had caught COVID. And many of us really had no idea whether we would be able to continue to get business done, how we would work, and whether our children would be able to finish the school year out, and whether we would have enough toilet paper to get through the week. Another thing that I blocked out from my memory that I don't miss worrying about. We were really battening down the hatches and preparing for what we thought could be, really one of the worst financial crises in a very long time. And we were gearing up for a very divisive election year as well. And so while all of those were macro issues that were really laid at all of our feet, each of us individually also had our own challenges and circumstances that were already laid ahead for us in 2020. In particular, mine was the merger of these two brands, which happened in December of 2019. And we were really gearing up for the team integrations and the cultural integrations and doing great things for our clients. And so all of you as business leaders had challenges like this that laid ahead. And then you had to see those through despite the unusual circumstances of the pandemic. So while it's not all roses for us today, there certainly are, as Jack mentioned, just undeniable signs of resiliency across all of the areas that our panelists are experts in. So our understanding of how to protect ourselves against COVID is much more robust. Dr. Goodman will get into this, but close to 20% of the population has been vaccinated at this point. We're hearing of a Goldilocks moment for the US economy with the potential for sustained growth into the foreseeable future. Many of us are planning with a little bit more urgency for some sort of return to the office, which we'll talk a fair amount about today. And in fact, on that note, I this weekend ventured into the foreboding depths of my closet to try on pants without waistbands. So I'm eager to learn whether I will have to undertake that endeavor in the near future. So with that backdrop in mind, I'm really looking forward to learning from our expert panelists today. And I'd like to welcome Dr. Jessie Goodman, Reggie Jones, and Shyam Kannan to join us now on video. And then gentlemen, what I'll do is I'll ask you all to spend a few moments introducing yourselves in that same order, please.
Good morning, and I'm really pleased to be with you, Evelyn and the team. I'm Jessie Goodman. I'm an infectious disease physician currently at Georgetown University. I care for patients there at the VA and at Walter Reed. My past includes leadership in federal government, where I was chief scientist at the US FDA, and before that was head of infectious disease at the University of Minnesota. Great to be with you.
Good, Evelyn, I appreciate it, and just wanted to thank Jack, the Board of Trade. Evelyn, appreciate you presenting. Certainly Najia Hassan, who's actually, you don't see her, but she's the brains behind the operation. And certainly I'm really appreciative of the chance to participate with Dr. Goodman and Shyam Kannan. I'm the office managing partner of the Washington, D.C. and Tyson's offices of Fox Rothschild. We're about 1,000 attorney firm based in Philadelphia, and I run and opened the DC and Tyson's offices. So we appreciate the opportunity to talk with you all.
Good morning, everyone. My name is Shyam Kannan. I'm the Vice President of Planning at Washington Metropolitan Area Transit Authority. I want to thank Jack and the Board of Trade for all of the leadership that they have shown over not just the past year, but the previous years as well. And my fellow panelists this morning. Evelyn, as you were introducing some of the topics, it dawned on me that while many of us had the opportunity to work from home over the past year, something like 50% of the region's workforce can't. And if you did have your grocery stores shelved, stocked with toilet paper, or your prescription filled, those individuals had to show up at work, and they are unsung heroes in this region. We don't often recognize them. And you can also probably thank a bus operator or a rail operator for getting them to and from work. We owe them a debt of gratitude. So a big shout out to the men and women who kept the economy going during these dark times, including our transit operators.
Yeah, it's a great point, Shyam, and we'll get to talk a little bit more about what you all have been doing across the last 12 to 18 months of what the plans are going forward. But Jessie, let's start with you, if you don't mind, setting a backdrop for what's happening with vaccines. So obviously, vaccine delivery steadily climbing. The Biden administration is saying that by May 1, every American who would like to get a vaccine will be eligible. In your opinion, does that mean that we should all expect that we can be vaccinated in May, or will it take longer to get through the population that's still willing?
Well, I think it is going to take some time. The great news is, as somebody said earlier, 108 million doses, 108 million people have gotten at least one dose of vaccine, 60-something million have gotten two. But to get from there to twice that or more, is probably going to take at least a couple of months and probably well into the summer. And the other issues on that include not only the time to immunize, but the fact that there's still a lot of people who are hesitant about vaccine, and also that we just now are starting to get the data for use in individuals that are adolescents and children. So that's going to take some time also to come on board.
Great, and I know we'll talk a little bit more as we get into this topic about herd immunity and some of the other variants, but Reggie, let me go to you for a minute. As more people are getting vaccinated and we are seeing a trend towards folks focusing on back to the office, to Shyam's point, folks who have not been working from home, help us understand what employers can require and what employees will need to disclose related to their vaccine status.
Yeah, Evelyn, that's a good question. And hopefully I won't make people's eyes glaze over or roll on the back of their head and pass out. So you don't need smelling salts. We are sort of entering what I would call a brave new world, not to unfairly quote Aldous Huxley in dystopian literature from the 30s. But unfortunately, the legal there's a patchwork of things. So I think in general, the EEOC has said you can ask whether someone's been vaccinated. That's okay. It's not a medical inquiry under the Americans with Disabilities Act. You can ask for proof of vaccination. So that seems to be regardless of what type of business or university or healthcare facility you're running. So that's the easy part. Of course, it then becomes more complicated because if you're asking for it, then more likely than not, you're requiring that people be vaccinated. And if you're requiring people to be vaccinated, of course, the answer is yes, you can require it, but then you spend the next several hours walking through all of the other pieces. And so the other pieces, and let me just stop before I say too much, is it is navigable. I want people to think optimistically that the DMV has done a wonderful job of continuing. Those that have had to go and couldn't, and then those who worked remotely, we have made it work. And while I certainly don't have Dr. Goodman's credentials, I do feel like I have a therapy degree. I got certainly 45, I've lost my 45-mile commute each way. So I spend much more time I thought I would have for downtime, really holding people's hand to make sure everyone is emotionally stable. So I do feel like that's been one piece of it. But let's walk through why it's navigable, right? If you want to require, certainly it's going to be a little easier if you're talking the healthcare industry, where there's definitely a direct threat to everyone around those people, or even if it's a university where you're talking about students, a little more complicated when you're talking about a university, the staff, right, or an employment situation. So, and that's really what I'd like to walk through just briefly, and that is sort of the big things are you can require the vaccination, but you have to navigate the Americans with Disabilities Act, and then really Title VII of the Civil Rights Act of 1964. You don't need to know all of that other than if someone says, I'd like an accommodation, I don't want to be vaccinated, and they ask for, or you have to do an interactive process to determine whether they actually have a disability as defined by the ADA, and then make reasonable accommodations, let them continue to work remotely. The same thing would apply. Title VII covers a lot of things, but sort of a sincerely held religious belief would be one. And then you could then have to make some type of accommodation unless these things cause an undue hardship on the company. And of course, that then kind of opens up the question of, it's interesting. I think there are people that want to require, there are people that say, I don't want you to come to work because you haven't been vaccinated. And then there are people who say, I want to come to work even though I haven't been vaccinated. And so you kind of get a little bit of and each situation's a little bit different. That said, your HR team can work through these things in my mind. And we have a COVID legal response team. So I'm not the only brain you're talking to right now. I'm channeling, the whole rest of the team from across the country. And interestingly, our head employment attorney says, I wouldn't recommend requiring vaccinations because of the headaches of trying to figure all of these things out. I disagree. I think you can do it. You just have to navigate carefully. It's the United States. We're not in Israel. We're not in Taiwan, where you just says, show up for your vaccine. We have to work through things to protect individual liberties. So you're going to work through those things. If you do, let me go back to the proof of vaccination. If you require that, or you ask people to disclose whether they've been vaccinated, obviously under the ADA, you have to keep that confidential. So unless the public health agency is asking, you have to make sure that's protected. But it is perfectly legal. You can certainly do it. But requiring it then takes you down the ADA route, Title VII, and you have to go through those inquiries. Now, let me just give you a couple things. One would be, I don't want to, I have a family member at home. I have a child who's immune compromised, so I'm not, and the answer is you don't have to, oddly, you can still require that person to come to work, even though they're afraid to come to work. So you have that kind of an issue. You have issues where I have one employer that just wants people to come back for efficiency, not because it's necessarily essential to the job. So all these little things you work through. It doesn't mean that you need to have me sitting there right next to you giving you advice, because that's cost prohibitive. And most of you are, one, wanting to protect and care for your workforce, and two, not break the bank when there's, in doing it by having a team of legal specialists. We don't want that. So last thing I'll tell you before, and I didn't mean to get too verbose. I'm a lawyer. People think I get paid by the word. I don't, I promise. One other little bugaboo is is this emergency use authorization that the FDA has done. There is one lawsuit out there, maybe a couple of others, one in New Mexico that was filed at the end of February, where an employee of a detention center, a jail essentially, sued officials over the mandate that everybody had to be vaccinated. And the complaint says it violates the emergency use authorization statute because the county that required it didn't tell him of his option to refuse the vaccine, and somehow that violates the 14th Amendment. I'm not a constitutional lawyer. I don't know that one's grown wings, but you see it coming, right? You see that will be an argument. That one ultimately didn't go anywhere, at least initially, but those are the things you have to think about, because it's a little bit different than your flu vaccine. And then actually I said the last thing, but it's an eternity. There's so much good stuff out there. Let's walk through it. We know already from things like on the religious, making a reasonable accommodation for a sincerely held religious belief, that won't work if you just have a personal belief that you shouldn't be vaccinated. And certainly if any of the case law that deals with the flu vaccine is the same, that won't work. But of course, it then requires you to ask those questions and then document those things. Again, it is navigable. Even within my own firm, we're going to disagree on some of these things. And while you don't want to hear every word and every sentence, it can be done pretty clearly and concisely, and probably in a shorter time than I just did it.
Well, to the point you've made, I mean, the legal aspects are one component, and then you mentioned a couple of different things that really just remind us the differences at every single office space, the cultural components, and just, the way folks are determining that they want to lead. But it is helpful to hear that the requirement is navigable. So as people think about options.
Yeah. And I also think that you should look at the state too. So then and luckily we're in these areas, we seem to be pretty similar between Virginia, Maryland, DC, but absolutely it's navigable.
Good. So Shyam, switching gears slightly, but still on this same topic of returning to the office and really resuming our commutes. I think we all recall that at the outset of the pandemic, the CDC came out and recommended that people avoid public transportation. As our understanding of the virus has evolved, in your view, has public transportation proven to be a COVID vector, and what are your perspectives on that?
Thanks, Evelyn. This is not about my view. The science is in on this, and the science is consistent and extremely strong that public transit is safe, if not safer, than the office environments, the restaurant environments, the entertainment environments that are reopening. And so we all collectively have to do some myth busting about this. Let's talk about just sort of the logistics. So in particular, customers that ride public transit spend far less time in those vehicles than they spend in offices, workspaces, or retail or restaurant environments. They typically don't engage with each other or speak with each other as they would in a gathering space. You might not know this, but in Metro, or at least Metro Rail, we recycle that air, or we freshen up that air every 180 seconds. So there is rapid air refresh going on in these vehicles where individuals are spending very little time overall. So those are the facts of the matter with respect to what we know now. In terms of what we know globally, there have been scientific study after scientific study after scientific study that have looked hard for evidence that public transit is in fact a COVID vector. And they haven't found that evidence. In fact, they found that it's resoundingly safe. So one thing that I want to make sure that you know is, and the audience knows, is that public transit is safe, and we are doing everything we can to continue to give customers the safe space they need on the vehicles. What we can do collectively is get the word out. We would love for the business community to help reinforce to their employees that public transit is safe. It is perfectly fine to get on that train, to get on that bus, and in fact, go so far as to say it's safer to be on public transit than it is to be in some of the environments that we're eager to get back to. I do want to caution that no one is immune from COVID, and that includes our transit employees. And so fortunately for us, our frontline employees are now eligible for vaccination across the region, and we've been aggressively moving to make sure that our workforce is protected first and foremost. So that's some critical information. We certainly could use the support of everyone on this call and the business community to engage in that myth busting with us.
Great. And just to kind of tie that piece up, I want to go to Jesse and just kind of get his perspective on what Shyam has shared, whether there are any nuances there that he would point us to related to public transport.
Well, I think Shyam makes an important point that as this pandemic has played out, we really haven't seen a lot of transmission in the public transportation sector. So, it's not, it's probably similar to everywhere else. If you're crowded, if people aren't wearing masks, if they're in prolonged contact with somebody, there is risk. But in public transport, if you're distanced, if you're wearing masks, there's a bunch of mitigating factors that Shyam mentioned. There's good ventilation generally. People aren't on it for long time periods. And these are things that tend to protect people. So I think it's something we have to approach with similar outlook to the way we approach everything else, which is you can ride public transport, but do it wisely. Be vaccinated. While COVID is spreading in communities such as it is now, wear masks in places that you can't easily social distance, and that includes public transport. But with all of that, we can, I think, very realistically rest assured that it's not some unique or terrible place and that it can be safe.
Great. So Jesse, let's stay with you for a minute, if you don't mind. And I know you touched on this briefly in your first answer, but can you give us sort of both a backwards and a forward-looking view of the vaccination trends in the US? So obviously rates have increased really rapidly over the last few months. Why is that? And then are there any other barriers that you foresee that we still need to overcome, or things that could slow down the vaccination campaign at this point?
Yeah, well, I think the biggest thing that's helped us is just supply. There's more supply. And then the engagement of the private and public sector widely in immunization and getting the immunization and vaccination much more organized and scaled up. And so I think those things have helped make the success that we're seeing now. But there are some issues. I think that public acceptance is still an issue. We saw even recently that 50%, for example, of Republican males state they're hesitant about vaccine. Traditionally, there's been hesitancy among minority populations at times. So these are things we're still going to have to work on. And then I mentioned earlier that we still don't have the data and FDA authorization for people under 18 for some of the vaccines and under 16 for one, Pfizer, and we need that.
Great. And Shyam, let me go back to you. So, we've been talking about vaccination rates being very encouraging. And you mentioned in your opening remarks that, Metro is one of those few businesses that really never shut down even this time last year when there was so much unknown. Again, looking a little bit backwards, can you share how you all remained open, how you planned for capacity, and then how that translates into how you'll plan for capacity ebbs and flows going forward? And I'll add a little something, because I saw a question come in through the chat about really about your comment around the ability to social distance on Metro and what that looks like going forward.
Absolutely. Well, first and foremost, safety trumps service. And I just want to make sure that everyone hears it. What we do at Metro is make sure that the journeys that our customers are trusting us to deliver for them are safe journeys. And that has been a driving force at Metro before the pandemic started, but it always helps to have a plan. And I think that it's important for this group to know that it was January of last year, before this region started to issue stay-at-home orders, that we actually activated our pandemic flu plan. So we had a game plan going in. We were prepared. We had thought through the type of actions that we need to take months in advance. And as the stay-at-home orders started to roll in, we were able to rapidly pivot and both keep the service going safely, as well as accommodate what we knew was taking place regionally. So from an operations and management perspective, what we did first, in March when the stay-at-home orders went out, is we pulled back on service a lot. We went into hunker down mode, delivering essentially just the trips that we knew were most essential for those essential workers to still get around, but encouraged everyone else to not travel. And the states and the district were encouraging folks to not travel, and we were encouraging them to do the same. On the bus network, what we did at that point in time to keep our operators safe and to make sure that we minimized any person-to-person contact was we switched to rear door boarding only. So if you're getting on a Metro bus, we cordoned off the first 10 feet of the bus so that the operator essentially had a large space that was separated from other individuals. And we also encouraged customers to board only through the rear of the bus, and we stopped charging fares at that point in time. So there was no contact with anything for the customers or the operators. We also adjusted our crowding standards. We're always planning for capacity, but we effectively cut our crowding standards by 80%. So for example, a bus that normally we would plan for having 40, 45 persons in that bus, we were planning for 10 people in that bus. And so that was part of our planning standard to make sure there was sufficient physical space in the bus to permit social distancing. We did a geometric analysis of all our vehicles. And we also permitted our bus operators to bypass a stop if they noticed that their bus was reaching that threshold, so that we could preserve sufficient space in those vehicles. On a management side, again, keeping our operators safe. If our operators weren't safe and they weren't healthy, then we couldn't do our job. So we actually split our staff into effectively two groups that wouldn't interact with each other. So we could shift them in with sort of an A team and a B team and keep the control center staff and the operations and maintenance staff separated. So that's what we were doing in those early days, but no, we kept going. We don't have a pause button, and this region is tough. This region doesn't have a pause button either. So kudos to you. Coming out of this, as we got smarter about what it was that would prevent transmission and how we could keep the customers safe, we implemented protocols such as mask mandates and enhanced station and vehicle cleaning. And it was very visible to our customers. And we were so going so far as to make sure that if there was something that we saw that didn't look right, we were stopping that train, stopping that bus, making sure we take it out of service and clean that right then. As we were then gearing up to support the region's recovery, and we noticed in this region that folks started to figure out how to get back to work, how to get to places in the summer of last year, we made it our goal to have effectively more supply than there was demand. So to have far more service running in terms of vehicles per hour and seats per hour than there were people out there, so that we could preserve room for social distancing. And so for everyone that's out there, we're right now providing about 85% of our pre-pandemic bus service. We're still providing about 80% of our pre-pandemic rail service, even though ridership for us has been, 5, 10, 15% of what pre-pandemic ridership was in the early days. And now on bus and rail, we're sort of getting to that 50% threshold for demand. So we're still providing more supply out there than there are customers to fill the space. And of course, it certainly helps that at the federal level, they've mandated now that any customer of public transit nationwide must wear a mask. So those efforts combined allow us to have more supply out there than there are people to fill that. And we're also planning to make sure that we provide that 6 feet of distance per customer on the vehicles, in the stations, in the mezzanines, et cetera, et cetera.
Okay,
Is that
great.
your question, Evelyn?
Yeah, no, that's very helpful. And Jesse, did you have anything you wanted to add?
Yeah, I just, you know, first of all, I'm so impressed with what was done. So thank you, Shyam. And I just wanted to add that our understanding of the virus has also changed. And, you know, it's not trivial contact with surfaces that spreads this virus. It's in the air. It's being next to people who have the virus, often don't know it, and are breathing it. So this whole notion that you just go into some public space and that you will get infected is wrong. And, you know, people do not have to worry that trivial contact with a surface, you know, or a seat or something like that is a problem. You know, of course, we still recommend, you know, hand hygiene and all those things before or after you're in any environment. But I think some of that fear that led to some of these initial prohibitions has been resolved by the science. And, you know, so I just wanted to emphasize that, you know, it's not like you go into a place and therefore you are infected because you touched a doorknob or you touched something. It really requires exposure to an infected individual.
Great. I think this is really helpful, especially as many of the folks who are employers on the phone look to give scientific, objective information to their folks who may begin to commute. So thank you for adding that on. So you all mentioned things that we have a little more certainty around. Going back to you, Reggie, really the area you're focused on is something where there's a little bit less certainty at this point. So share with us what liabilities might employers be facing right now if they require staff to report to the office? And do you have a view on how those liabilities could potentially change over the coming year?
Yeah, no, those are all good questions. I mean, I think one and the big ones to start sort of with the answer I gave earlier, certainly there will be those that say you're not making a reasonable accommodation for me, you know, under the ADA or Title VII. So those are sort of the big ones. And those ones are certainly scary because, you know, one, under the ADA, it's, you know, $75,000 for the first violation, and for every additional violation is $150,000. And then, of course, if you start wandering into the negligence world, you start getting into compensatory and punitive damages. And not to mention, all of these things, when you do the inquiries, are necessarily interactive inquiries. And are you treating similarly situated people the same? And of course, the only way to find that out is to roll up your sleeves and figure that out. Of course, then, and then one of the questions that came up too, what other considerations besides those things? Certainly, I did throw out the authorization statute is one that people are using, so you get some litigation costs. But then if you require people to be vaccinated, you know, you have a Fair Labor Standards Act issue. You have to pay people to do that, you know, take the time off. You have, you know, if somebody, you know, it contracts COVID from your office, is there liability? Is it covered by workers' compensation? Certainly issues like the, you know, FMLA and issues where if someone says, I'm not coming back because I'm not confident everybody's vaccinated, and I have to stay home to care for someone who is immune compromised, you need to make sure you're providing those things. I believe your HR teams, though, are sensitive to these issues. I would say a refresher with, you know, your in-house, you know, I know candidly, even on this conversation, there's some excellent in-house employment folks at each of these organizations to just go through and create a matrix to make sure that you're tracking these liabilities. No, you certainly don't want to run. And again, that's why, at least in our firm, you know, what our head of employment says, I wouldn't require it. The EEOC even comes out and says, you know, they punt, right? They say, well, we think you can, but they don't actually come out and say that in their guidance. And they say, ultimately, you probably should just, you know, recommend it rather than requiring it. But these issues aren't necessarily a whole lot different than what you've had with people that say object to the flu vaccine. The other consideration is each state is a little different, right? Like Massachusetts, Alabama, there's quite a few that give you grounds to refuse to take a vaccine. So that's another layer. You know, the DC, Virginia, and Maryland don't have nearly the complexity. Pennsylvania, for example, says all businesses must require with the CDC guidance. So you just need to look at that. So like, for example, our knowledge management, since I run 2 offices and we're about to move in just a couple of months to new space, that's of course smaller because we started designing it before, we're trying to follow the CDC guidance, even though it's not necessarily required. And I have our knowledge management team every day. Anytime there's an order issued by any of the local entities, we get that. And then presumably all of your HR teams do something similar and try to adhere that guidance. And then, of course, lastly, the unsatisfying answer is that when you look at it and it doesn't quite make sense, raise your hand and just chat with either your attorney or even in our office. I never believe my own baloney. I always talk with someone else in the office to make sure that we've covered it and we're being fair and protecting people's rights. So, I mean, hopefully that makes some sense. We don't want to wander down into the punitives and the so forth. But there will always be a little bit of tension because you're going to have people that say, I want to come back and I'm not vaccinated, or I don't want to come back because other people aren't vaccinated. Right. There's all sorts of issues. And then also too, lastly, the risk. DC also has a lot of us, we're bankers, lawyers, accountants, people that are not doing what, that are not in healthcare and are not in transportation. And so the needs, in other words, are we really a direct threat if you come back to the office? Because many of those professions can be done remotely. And so it's less compelling whether those employees will present a direct threat to others. So those are just things you have to think about. But again, it is navigable. It's just that unfortunately fortunately or unfortunately. Fortunately, we have many protections for your civil liberties. On the downside, when it comes time, you can't direct things nearly like you could in, say, other countries, which makes it a little bit more complicated.
So moving away a little bit from the legal aspect of this, you have the benefit of working with, and your firm does a lot of different clients. So as employers encourage their teams to be vaccinated, let's take requiring off the table. What types of creative tactics have you seen employers deploying for that encouragement component?
Honestly, I think I haven't seen anything that works perfectly. That I have not seen. I've seen certainly companies that have encouraged it. I've seen those that have given out sort of smaller items, gift cards, things that are small. That I think is fine and easy. The problem that you get into is if it's $500 or more, you start to get into, does it violate the ADA? Because, for example, let's assume you're pregnant. There's no vaccine approved, to my knowledge, for someone who's pregnant, and they can't get that. So now you're discriminating because you can't, and your participation needs to be voluntary. Honestly, I really enjoyed, and of course, in the United States, no good deed goes unpunished, right? So look at Krispy Kreme, right? Krispy Kreme said you get a free donut if you're vaccinated. That's promptly prompted the folks who are against vaccines to get a donut on Mondays, and everybody else. And I guess they don't get. And then obviously the health community said that obviously it's not healthy, and there are in fact those that go in every day to get their free donut from Krispy Kreme. And any self-respecting Southerner knows that you can't eat just one Krispy Kreme; you have to eat at least 5, right? Because they're delicious. So. I think I have seen people try to do things, but then they get in trouble when it becomes too big. So the smaller items, I think, have been easier and have encouraged people. But I think as it gets bigger, you just start running into bigger problems because then not everyone necessarily can get it.
Right. So I'm sure, Jesse, you have perspective on eating 5 donuts a day, but we're not going to cover that topic here. So, but I would like to go back to you and continue this theme of employers encouraging their teams to be vaccinated. And part of that is because we hear on the news that this is really a race between vaccinations and variants. So can you talk a little about how the variants work and whether the vaccinations will be effective against them? And then there was also a related question that came in through the Q&A about the duration of the vaccines. Again, those are all sort of race against time topics.
Yeah. So all good questions. The duration, of course, this is all building the airplane as we're flying it, in terms of we're learning about these vaccines because they're being rolled out as we speak. But, at least from data on Pfizer, it appears that the high degree of effectiveness is both transmits from the clinical trials out into the real world population, and then also does so for at least 6 months. And, I would say, based on the science, we do expect these vaccines to last at least that long in terms of protection, and likely a year or more. So far that news has been good. On the variants, so here the issue is that this is a kind of genetically unstable virus that's always throwing out changes in its proteins that then are what the vaccine recognizes. So it's trying to confuse our immune systems and make it so vaccines are less effective in a way. So far, the good news is that even against the variants that are most concerning and that are different the most, like the one in South Africa that originated there, presumably, these vaccines are still quite effective at least preventing severe disease, hospitalization, and death. So they still have significant effect. On these variants, they may have varying degrees of effect in preventing infection and transmission and mild disease. So with some of the vaccines, it's been more, instead of the 90% we keep hearing about reduction in infections, it might be 60% with the South Africa variant, but much higher than that in preventing severe disease or death. So far this is good, and these are good reasons to get immunized quickly and get your population and your employees immunized quickly. However, what I would say is we can anticipate that there may come a time when the variant viruses are more efficient at escaping vaccine, and where we may need to give an additional dose against a particular variant, or booster doses that raise up the overall level of immunity. So that's the current thinking of most of us in the infectious disease community, is this will become not an eradicated disease by vaccine, but one that's going to be with us for a while, maybe for a long time, like influenza, maybe not, and where we'll need periodic boosters or adjustments in the vaccine to account for the way the virus keeps varying.
And when you think about the supply of those boosters, obviously there was a lot of waiting for the vaccine to come out this first go round. With the boosters, do we start again from scratch, or will those be more readily available within 6 months to a year?
Yeah, that should be a much more accelerated process, for two reasons. One is the manufacturing issues have been worked out, and the whole supply chain is improving. It's been a real challenge. And then the other is, from a regulatory point of view, these are just minor modifications of the vaccine, just minor changes in the gene that's included. And they're not expected to affect safety or effectiveness. So FDA can review these based on small amounts of data that show that the vaccine behaves as expected in a much smaller number of individuals. So I think that can happen much more quickly. What is concerning, and it's beyond the Washington environment, is of course until the whole world, until the outbreak is controlled in the whole world, or even our whole country, or even our whole region, we can have places where these variants arise and spread rapidly. So, another reason to consider immunization, not just as a US need, but as a global need.
Great, very helpful, thanks. So Shyam, let's go back to you. You talked a little bit about, give some great insight and statistics about capacity and how you all have, a lot more capacity out and about than you do ridership. I know for Truist, we are looking at really June as a starting point to send our non-branch teammates. Of course, our branch teammates have been in the office and assisting clients throughout the pandemic, but our non-branch teammates back. So I would assume that over the summer, we will see upticks. How are you all planning for those changes over the next 6 to 12 months? And then you touched on this briefly, but I want to hone in on it. What can employers in the DC area consider in terms of information and sources of information as they encourage folks to come back into the office and to resume their commutes?
Great. Well, I think that there's a sigh of relief for not only your metro, but every metro around the country that Congress did step up recently to support transit in all 3 COVID relief actions. And that included funding to keep metro service here and going for our customers and jobs in place for the employees. So first and foremost, thank you to those who worked tirelessly behind the scenes to ensure that those bills did include sufficient funding to keep our service going. In terms of what you and your employees and the other employers on this call and in the region can expect, we expect to continue the same service levels that we have, that we've had in effect since August. So remember, that's about 85% of our pre-pandemic bus service, about 80% of our pre-pandemic rail service, at least through June 2022. That's sort of a baseline right now. And that includes, so that's if you're in the core of the region, that's a train every 4 to 6 minutes. And we'll continue. Currently, our thinking is to have that capacity in place. Again, it is about, it's many times that that we're seeing in terms of current demand. And as that ramps up, we should have more than enough running room to capture the workers that are coming back to the system. So that's a good thing. We'll continue to operate weekend service on the Red Line and rail about every 12 to 20 minutes, and about every 15 to 20 minutes on the other line. But again, taking that back to the kernel there, if you're in the central business districts of this region, you can expect a train every 4 to 6 minutes. That's fairly normal for most people. That's what they expect, and we'll be there for them. And we're going to continue to operate them. I do think it's fortunate that aside for some pre-planned capital investments, all of which we plan years in advance, this additional funding also kept us from needing to think about some station closures. So your station will be open, your trains will be running, your buses will be running at almost the same level of capacity that we had prior to the pandemic. For Metro bus customers, some things to look forward to prior to June would be some additional service improvements in the next few months. So we're going to restore full or partial service on 10 lines that had been previously amended because of some of the budget uncertainty. And we're going to extend late night service until 2 a.m. on 34 lines. So again, that should feel fairly normal. That should feel much more like the transit system that your employees had in 2018, 2019 than during the pandemic. In terms of information or things that employers can do to help, again, first and foremost, help us with the myth busting. Transit is safe. Your trip on transit will be a safe one. And it's unfortunate that we're sort of coming at this a year later, trying to combat misinformation. However, I don't want to disparage the professionals that were doing all they could with great levels of uncertainty a year ago about where the virus was and how it is transmitted. But the contact services are safe. You're safe in transit. We're refreshing that air every 180 seconds. So come on back. So help get that word out. The second thing that I think is more of a management question for the employers in this region is you can consider, and if there's an opportunity to consider, flexibility in work schedules and start times for your workforce. If you think about the pre-pandemic times where on Metro Rail in particular, we had these enormous peaks in demand in the morning and in the evening where everyone needed to get on the train at the same time. That definitely bumps up against our desire to maintain significant amounts of space on the system to preserve social distancing. So to the extent that you can consider staggered work schedules or flexibilities in work start times, that helps us reduce crowding across the system. So that's something that employers can do. In terms of information, I think, Evelyn, you were launching into what sort of tools and information are available. A couple things that folks that haven't written since 2019, 2020 might not know about. So first of all, Metrobus customers can now see how full a bus is before it arrives, along with historic crowding information on rail that helps folks plan a trip that they're comfortable with. If you want to know whether or not the trip you're about to take may be more or less crowded, you can now get all that information, not only in the trip planner that we provide, but it also feeds out to the apps that folks use like Google Maps and Apple Maps and other trip planning apps. It also feeds out to the tools we deliver like Bus ETA, which helps you understand where your bus is. So we're feeding that information to customers to help them plan a trip with the crowding levels that they're comfortable with. We're also thrilled that some of our private sector partners, for example, the Greater Washington Partnership has put in their COVID resource page a transit tracker, which lets employers see how crowded a rail station might be, how crowded a line might be. And if you pull that up right now, you'd see lots of green indicating plenty of space. So you can push that out to your employees as well to help give them that comfort level that the trip is safe. A couple of things that you might not have seen if you haven't been with us in a while is, for those customers that had been with the Smart Trip system for a while, that was pretty cool, but in effect, it was also contactless. You might not have known this, but you actually didn't need to physically touch that card to the reader. But now we're offering touchless mobile pay across the bus and rail system. You can reload your Smart Trip card right on your mobile phone and pay with your trip using, right now, Apple Wallet. And we're currently working on support for Android OS systems. So you can have a completely contactless boarding and payment and planning experience. So those are some of the things we'd hope help customers as they rejoin us. And we're hoping that employers can use that information to help get the word out.
Great. And I think it might be helpful if we can disseminate some of those links and different resources out to the group that's in the audience today.
Absolutely. Absolutely. For information on making sure that your Smart Trip card is registered, and then you can go contactless, you can go to WMATA.com and you'll see information there about making sure that your Smart Trip card is migrated to your mobile device. And Evelyn, I'll try and make sure the other information is pinged across.
Okay, great. And then in terms of our last pre-planned question that we have time for today, I want to wrap up with you, Jesse, and end on this concept of herd immunity, because it's really been out there as sort of the holy grail for the US over the last year. Can you share what percentage of the population needs to be vaccinated or have had the virus for us to have herd immunity? And then one interesting question that came up is whether that also applies to smaller groups of people, workplaces, et cetera.
Yeah, well, the scientific community is very uncertain about this herd immunity issue. This comes from something like, measles, where if there's very little circulating and almost everyone is immune, the virus will essentially die out, and it will only pop up again if it's introduced into a pocket where that level of immunity isn't there. And that immunity could be from natural infection, potentially, although for COVID, that looks less effective, that immunity, than vaccine-induced immunity. By the way, that's another point to convince your employees that to get vaccinated is this is one of the few infections where actually the vaccine seems more effective than getting infected and protecting you against future infection. But what I would say is the idea that somehow magically we're going to reach a point of vaccination numbers or past infection put together, and numbers have been given like 70 or 80%, where essentially then the virus would die out. I think that's coming under increasing question. On an optimistic end, what I would say is when we get to that level that 70, 80, 90% of people were either vaccinated or were previously infected, I think we're going to have much less transmission of virus, and it's going to be a manageable situation where life can get pretty much back to normal as long as we continue to get vaccinated. So I think that's what we need to aim for. And Probably 20% of our population, we don't know. It's 10% officially, but I'm sure it's at least twice that, have already been infected, okay? And then, so if we, in theory, if we got another 60 to 70% immunized and all those people stay immune, then we're going to see a real damping down of infection, and that's what we need to aim for. But I'm a little worried this virus has thrown us too many surprises, and we've got the variants we discussed, and it's not just that they might ultimately, the vaccines might be less effective against it, but many of them are more transmissible. So, suddenly you've done all these good things to reduce transmission, you got vaccinated, yet the virus is getting more capable. So I'm optimistic that when we get 70% of the population hopefully immunized, and you add that to the 10, 20 that have been infected, we'll see a very dramatically different situation. But as the CDC director and others have said, we've got to be a little careful not to take the foot totally off the brakes. And it's this fine balance between encouraging people that there is an end in sight, there is a reason to get vaccinated, and realizing that if, even if a vaccine's 90% effective, if there's a lot of virus still circulating, people who are vaccinated are still going to get infected. So, we just, it's complicated messaging. We're going to get to a much better place, but it's not going to be like turning off a light. I hope it is. Maybe someday it will. But right now, it doesn't look like in the next few months it's going to be turning on a switch.
Great. Thank you very much. Very helpful. So to wrap up, we're going to do a quick round robin. And one of the questions I think that comes up commonly really is around tactics. So what are employers doing? What are some of the best practices we can share with each other around tactics, strategies, approaches? And so we're going to ask to name one of those from each of you that your own employer has deployed effectively during the pandemic in order to engage employees as we work towards returning to normalcy and returning to the office. So Reggie, why don't we start with you?
Yeah, no grand solution, but candidly, because we have 27 offices across the country, one of the things they've done is just that they have their trivia games, and then they work in issues of safety. So honestly, that to me has been the one thing that has kind of held things together when we can't get together. The issue we're grappling with, of course, is I think the legal side we have under control. The question is, I think we know, and many of our clients are government contractors, they're already everybody's vaccinated. What does that mean? I'm still wearing a mask in the office. I still have 25% max capacity. Let's assume everybody's vaccinated. We're looking forward to that next step of what does that mean? All the clients that call and say, we want to require it, it's because they want to use less protective measures in the office place. For example, having two people travel together in a car, as part of a government contract. That's what I think, that's the question, candidly. I hate to say it, it's not a solution. That's the question that almost everybody has.
Right, makes sense. All right, Jesse?
Perhaps the area where I can share something, and some of this has been in the press a bit, is that in terms of as you consider immunization and trying to encourage your staff and employees to get immunized, I think to sort of take this to the individual level, to realize that sort of messaging, alone is not going to solve the problem. You need to sit down and respect people and have knowledgeable people answer their questions one-on-one.
Great, thank you so much. And Shyam?
Culture eats strategy for breakfast. And one thing that at WMATA we're very grateful for is from Wiedefeld on down, they from the get-go embraced this ethos that the safety of the workforce was paramount. And our CEO, our board, our executive team, they really treat the workforce like an extension of their family. And I know that might sound a little bit, it sounds however it sounds, but that trust, that bond that they forged, that they were not going to put folks in harm's way, that they were going to make sure that the first and foremost thing was not only that the workforce was safe, but they felt safe. that goes a long way. At no point in the last year was there pressure on workforce, on whether you're, a jacket and tie person like myself, or whether you're a bus operator mechanic, to be in a place that we couldn't look at someone in the eye and say, you are safe being here. And as we now prepare to bring folks back into the workplaces, that trust, that bond, that mutual respect, I think makes everything work better. So we're very fortunate to have a CEO that embraces that philosophy and an executive team that does, and hopefully that will continue to support us going forward.
Great. Well, I think ending on those themes of leadership, trustworthiness are really apropos for everything that we're trying to accomplish here and that the Board of Trade has us together for. So I want to thank you all, the panelists and the audience, for your time, and I'll pass it over to Jack just to make a few brief closing comments.
Great, thanks, Evelyn. And that was a really interesting conversation. We ran out of time. I know we're over by a couple of minutes, so I'll wrap this up. There were a few questions we didn't get to, but there'll be many more of these conversations, so please stay tuned. Because there's a lot going on and there's a lot that we have to work through as we do this. And then Reggie, Shyam, and Jesse, thank you so much. That was really interesting, and I know there's a lot of other things that we can keep talking about, and we will. So thank you again for being with us. And thank you everybody for joining us today. We really do appreciate it. And look forward to seeing you all in person very, very soon. So stay well and have a good day.